I think a lot of people forget that there is, or don't even know the extent of the problems so close to home. So that's why we've chosen to try to help out our closest neighbours in East Timor.
I think the first thing that hits you when you are arriving in the plane to East Timor is just the lack of infrastructure. Here you have a country that in many ways is one of the newest nations in our world. It's had a very violent recent history, and the health problems there are shocking. When you're walking down these streets of East Timor and you're talking to the people, you just start to realise how little they have. I mean, they live in these shacks with basically next to no money. I mean, getting a job is next to impossible here. In the winter months, you have families and children eating bark for food because they can't afford anything else. And on top of that, they're finding it hard to access water. They've got poor sanitation. I mean, and then they have the burdens of all malnutrition and all the medical things going on. And I mean, what we're trying to do is not try and fix all these problems. We're trying to just focus on a couple of simple things to try and give these children a better chance. It's easy to look around you and think the need's just too much. But I guess we've taken a step back, and what we're trying to do is help out on the healthcare side. I mean, it's not going to fix all the problems by any means, but it's a start. And there's a great need for healthcare assistance in this region.
Warren and I got the opportunity to go to East Timor in November last year, so 2013. I think the reason we both really wanted to go there was to just get the opportunity to see what it was like in a developing country, the healthcare, how it all worked practically, as we'd both had experience so far in our medical degrees, like in local hospitals where you have state-of-the-art facilities and people get the best healthcare that they can get.
The Bairo Pite Clinic is a 55-bed clinic that's only about 10 minutes from the Dili National Hospital in the capital of East Timor. In this 55-bed clinic, Dr. Dan, who heads up the clinic, who's been there since the very start, he sees up to 300 patients a day. The clinic itself does more than 30 births a month and sees more than 2,000 patients in a year. And a lot of these patients are very ill with TB, malaria, even some more rare things you won't see in Australia, things like leprosy, things like neurocysticercosis, which is when a tapeworm lays eggs in the brain.
So you walk into the clinic and there's 300 people over the course of the day sitting under this tin roof, in a 30 tin roof, sweating. They've all lined up to get a ticket to see Dr. Dan, and some of these people have come from down in the mountains. They've come hours and hours just to see him because he's such a well-respected doctor. I spent the morning with him one day, and one memory that I will never forget is seeing this 8-month pregnant lady with 5 children of her own bring in this tiny, tiny, tiny little baby in her arms to see Dr. Dan. And the story was that she'd been found in a market as a newborn baby, like days old. This baby had a bright pink beanie, woolen beanie on its head, and its head was huge, like the size of a soccer ball. And I just remember when Dr. Charlotte took the beanie off the baby and just said, "This baby is very, very sick." And it's something I'll never forget because the baby itself, her body was probably only weighed about 1 kilogram, and this is a 4-month-old baby, so babies here would be weighing 6-7 kilos by that stage, and it looked like it was maybe no more than 1 kilo, the body. Her head was literally like a soccer ball, from a thing called hydrocephalus, so having too much fluid in the brain. That kind of thing can be easily, or in certain patients can be easily sorted out in Australia, no problems. Over there, there's no neurosurgeons to just turn up and help that little baby. So that was something I'll never forget.
You know, it's incredible. Here you have a country that's 90 minutes from Australia. I mean, that's half the distance from Brisbane to Sydney. And yet, a child in East Timor versus a child in Darwin, it's the difference between whether they live or not.
So the situation over there is pretty dire. Dr. Dan and his team, they do an amazing job with what's available to them. But there are a lot of ways that we can help, and what Ubuntu Through Health and the Ubuntu Through Health community are going to do is really focus on things like malnutrition and education in the paediatric health. These are things that we've done before.
So what we've learnt from our previous projects overseas is that to have a successful and sustainable project, you need a couple of key elements. The first one being you need to actually go there and you need to identify a problem and you need to come up with a simple solution to a big problem. The second element is making or forming a strong relationship with a trusted local partner on the ground. So in East Timor, we've done both of those things. We've gone there, we've identified the areas of malnutrition support and health education in the paediatric field, and we've formed a really strong bond with the local hero that is Dr. Dan Murphy and the other health practitioners at the clinic. So that's why we're looking forward to making a big difference with this project.